Director Therese Arriola. Good morning, Therese.
Good morning. Buenas day, everybody.
Thank you for joining us. It's a beautiful day outside of behavioral health and wellness, it looks like.
Yes, it is.
And we just wanted to bring you on. So it was, I think, a couple weeks ago that we had broke the story about the group home and the positives there. And you had come on and basically said that they were isolating at the house. So can you just catch us up and update us on the status of that?
Um, yes, thank you for asking. I'm very, very happy and pleased to report that the Guam Behavioral Health Youth House that I had reported about 3 weeks ago, who had been exposed to the virus, has been cleared by public health on the 16th. And so all the clients and all the staff that have been positive have been cleared. I am grateful and thankful to public health for their diligence in checking up on the home and the clients. I am very thankful for my nursing division, who also been checking up on our home. Um, the good news and thankful again, always thanking God, is that they were all asymptomatic. And so that's all I kept praying for. That, the fact that they're positive is one thing, but please remain asymptomatic so that the trauma of knowing that they have the coronavirus is not um, doesn't get intensified. So that's the good news. Everybody is clear. Public Health cleared them on the 16th. And so I'm very, very pleased and grateful for everyone's prayers and all their support, especially public health and our Guam behavioral health nurses who constantly checked on them. Um, as a result of that, Chris and Sabrina, of course, the protocols, which have been so strict already prior to the exposure, had to be revisited, relooked at, and strengthened. And so this is an example of how you can have all the protocols in place and you can constantly train, constantly remind, but it's the behavior of how we behave outside the workplace, that's critical. In the workplace, there's a lot of instructions, protocols. It's everywhere. Constantly being reminded by your supervisor, plastered all over the walls, reminded by each other. But the concern, and which I'm always repeating to to my staff and to everybody I talk to, is be careful what you do outside the work hours, because what you do, your behavior outside 8 to 5 or outside your work hours, is going to determine what's going to happen in the workplace.
Good advice,
So,
Therese.
we're very pleased that everyone is healthy, um, and asymptomatic, that their trauma of having COVID was not deeper because they were having to deal with the symptoms. And so I'm just grateful to everyone who kept Guam Behavioral Health in their prayers, and public health, especially public health and our
Right.
nursing division.
Uh,
And of course, the managers who constantly checked up on the house.
Teresa wanted to ask because there's just been so many deaths, COVID deaths, and every time they put out a release about deaths, they put that blurb in there that you can call the crisis hotline 647-8833. What kind of
That's
traffic
right.
are you guys receiving at the hotline? Because we know that it's been
Heavy,
overwhelming, right? So what's the status on that?
heavy traffic, heavy traffic, and that's you know, work like you said. Every joint information release of any kind is, and especially the kind of where they're renouncing the deaths, where our crisis hotline has been shared, and so there has been such an increase in popularity of the crisis hotline, and that's okay because that's what we're here to do. We're here to help. Um, 7 months ago, the crisis hotline was only known by a few. Today, it's known by a lot, and probably on people's refrigerators and post-its, and hopefully some. We've had so much PSAs, advertisements, um, social media pushing of the number that I hope that it is today a household name, because COVID or not, Guam Behavioral Health is here to help. Um, Anxiety, depression, overwhelmingness of life itself in general um, is not a COVID thing. It's a life thing, and so there has been great, very very heavy traffic to the crisis hotline, which, if you would, brings me to a point of some good news. Guam Behavioral Health received a couple weeks ago, or I would say 3 weeks ago, news that we received $621,000 from FEMA. This is a FEMA grant that we applied for when we made the threshold of 130 positives way back. I think we're at 3,000 today, right? So the
Almost
minute
4,000.
Guam hit 130,000, we qualified to apply for this grant. And so we applied for it, and we received word about 3 weeks ago that we received the award of 621,000. It is only for 9 months. We call it the Mengaigiham grant because, as you know, in Chamorro means we're here. We're here to help. That's going to shore up and support and augment our crisis hotline. So we're able to hire more people, and we're working very closely with the master's program at the University of Guam, and hopefully they will catch the excitement and the itch of working at Guam Behavioral Health, that it becomes a recruitment tool later on. So we're very happy to report that to the people of Guam.
Thank you, Therese.
I just wanted to know, do you guys have data on the demographics of the calls that you guys are receiving to the hotline?
Absolutely, absolutely. I mean, we can get that to you, but specifically, it's across the board. It's male, female, all ages. You have calls for anxiety, calls that are somebody just needs to talk, and they're fine after that first conversation. We have calls that we realize that are deeper depression that leads to intake, and they actually become a client of ours, and we're going straight into telecounseling. So we're across the board, the whole gamut.
So-
Everyone's calling for various reasons. Of course, the unknown. We get calls. When are we going to get the vaccine? I would like to know too. But what we should be telling people is the vaccine today is the masking, the social distancing, and the hand washing and the sanitation. That's the vaccine today. The numbers last night is alarming. I think, if I'm not mistaken, that might have been the largest number report on a daily basis of a positive. I remember when it was 111 or something, but I don't recall 130, right?
Yeah.
That was alarming. But have you seen, you said you have seen an increase in the traffic in phone calls to the crisis hotline. Have you also seen where it's gotten to the point where you've seen an increase in the intake?
Absolutely. So Guam Behavioral Health has gotten busier because, as I mentioned, those calls can lead into, some calls you can handle right there in the first call, and they'll say, "Thank you very much. I just needed to get off my chest." We always give them the option. Would you like to have more services? No, I think I'm okay. I'll call you, if I feel anything. But then there are calls, at least half of the calls that go into, yes, I need to talk to somebody again, which leads to intake. And what intake means is they become an actual client of ours. We go through the assessment process and they're assigned a counselor or to be seen. And so, yes, as the volume of calls increase in the crisis hotline, the volume of work and counseling increases as well. That is always a concern because I'm always recruiting for counselors and, just get it out there. I'm looking for counselors. Um, and so, because we also want to have a manageable, healthy caseload for my staff. We don't want to overburden the staff. And that is why this grant from FEMA to shore up the crisis hotline is going to be critical, because I'll be able to take those responsibilities, because they're wearing dual hats. They're answering crisis hotlines and
Counselors.
giving counseling. So they have different schedules. So that will be very helpful so that they can just concentrate. The counselors can be taken offline, literally off the crisis hotline, and concentrate on their caseload and deliver quality service, because that's what's important as well.
Therese, I wanted to ask because it became an issue with public health where they were talking about outreach into the FSM communities, putting out info, graphics, charts in those languages of the different FSM communities. Is there anybody who speaks the different languages at the crisis hotline? Has that been an issue at all?
Not that I recall, but we do have staff that are from various nationalities and speak different languages, but I haven't been told of that. But if necessary, we do have counselors, and we do have counselors, we do have staff who work the crisis hotline that have different native tongues, so would be able to if that was the case. But we have not had the concern of a caller that couldn't communicate with us.
What about an increase, I guess, in admissions? Is that?
Increase in admissions, I just received it fluctuates. Admissions fluctuates. The good thing is because Guam Behavioral Health has been open and we've never closed, our staff, our social workers, our counselors have, no matter what the PCOR is, whether it's PCOR 1 or 3, has always been in communication and reaching out to our clients, even if it's through telephone, and constantly telling them, especially those on medication, that we are open, our pharmacy is open. So that has assisted in keeping crisis down to a manageable level. But I'll tell you, sometimes it just depends. It just depends. Some days there's an influx, and some days it's okay. Today, I have a low census of crisis that needed stabilization. And so today's crisis numbers are below 5. And there are days when it's up to 10 in admissions. So it just really depends. But we're doing everything we can to ensure that our clients, our current clients who are on medication, stay on their medication. And that's why it's critical that we needed to get it out there that our pharmacist is open. And above all, this is not the time to skip medication. You need to continually maintain your maintenance meds, whether it's psychotropic for mental health patients or just your regular maintenance meds, your medical meds. This is not the time to let go. Clinics are open, Guam Behavioral Health is open, pharmacies are open. Keep up with your medication. That's one thing that can help lessen the stress when you continue your maintenance medication, no matter what it is.
Thank you, Therese, so much for your time this morning.
I mean, we always hear about.
Thank you very much, everyone.
We always
have
hear
a good
about.
day, and I see my colleagues on the Zoom room,
Mhm.
JQ and I. Have a good day. Thank you.
Thanks, Therese.
And Art, Nice meeting you.
Therese, there's virtual
everyone.
Nasubi, and there's also the Navy biscuits there and butter. If you want to take some on your way out.
Thanks, but no thanks. Thank you.
Okay.
Thank you very much, guys.
Okay, Therese, thanks.
Please, everybody be safe.
Okay, right.
Be safe.
It's 7:38. Let's keep it in the K-Wave News Zoomer. We have a Zoom room where we have some breaking news this morning out of the Guam Power Authority, Guam Waterworks.